I am going to give an overview of administrative controls in multiple settings, and I will also touch on country experiences. So in our facilities, we know that countries kind of struggle to come up with policies and guidelines, but to some extent, some countries have those guidelines, local guidelines, and we also have international guidelines, but the difficulty is the practical implementation of those guidelines, and also the sustainability, and of course resources that are needed to implement those guidelines. And that has created a challenge to some extent. We are still seeing high burden of undiagnosed TB, high delayed diagnosis and treatment in healthcare settings and also congregate settings. And also lack of adequate or even non-existent surveillance programs for healthcare workers. So COVID came, it heightened a need to strengthen infection control measures and also the need for preparedness for the future pandemic. In the same breath, it also affected the global response to TB and other conditions. And staff get reassigned to other programs or departments, and also the allocation of resources shifted. So we need to strengthen infection control measures. I'm going to be taking you through key elements of the package. The guidelines need an understanding of the interdependence of various infection control measures. You have your administrative control measures, you have your environmental control measures, you also have your respiratory protection. I'm not going to dwell too much on environmental and also respiratory protections. The presenters after me will focus on that. So these are the key elements of this integrated package. WHO stresses the implementation in an integrated way and not implement various interventions individually. You have your triaging there, and with triage, it's not only tracking patients. It is important that you make sure the resources are available and you educate healthcare workers and also patients, and also just continuous training on TB. With regards to respiratory separation, it is important that once we have identified people with presumed TB, that we isolate and reduce transmission within these settings, and also ensure that we put them on treatment immediately. Respiratory hygiene is also important to reduce dispersal of respiratory secretions. It could be your mask, it could be in whatever form that covers your mouth and also your nose. And we have germicidal ultraviolet. I'm not gonna talk too much about that. There is a speaker that is going to talk about that, ventilation, and also Grigor will talk about respiratory program. So the first step is to develop an infection control plan, assign responsibility and authority, conduct risk assessment, and the plan should be based on the risk on the level of the risk identified. You develop written policies, SOPs on what you're going to implement, protocols and practices, and then you put a plan in writing and make sure that it is easy to understand, and healthcare workers or who it's directed to will be able to follow and will get access to it. And you make a plan, practical, affordable, comprehensive enough, and include a budget. Some interventions that can be implemented immediately, some might be long-term plans in So you still need to budget for those, whether it is a short-term plan, and you implement that written plan. In terms of the risk assessment, I mentioned that in order for you to implement your plan, your interventions will be based on the level of risk. So you evaluate the effectiveness and implementation of the plan, you identify the gaps and come up with action items. You assemble a multidisciplinary assessment team, you establish procedures for documentation of all activities and the results. And this is quite important because you want to look at the trend and say, this is where we started. This is how we're doing, let's say, before COVID, and then later on, there is some improvement. We've implemented certain measures, and we are seeing a difference. You establish procedures to validate and verify the intervention. You investigate all patient pathways to identify high-risk areas. You review the location of where the TB services are provided. This is just to ensure that you're not exposing immunocompromised patients or clients. Then you will identify and recommend corrective action, which should be implemented systematically and monitored. I will talk about monitoring later on. And then, of course, you would need to periodically conduct risk assessments. So the administrative controls are meant to reduce exposure and therefore reduce transmission. We have triage, I've spoken about that. These are the key ones, and then also separating those patients once they have been identified to be TB presumptive, and you provide respiratory hygiene while you're doing that, and also make sure that you put them on treatment and ensure that you do your DST so that we know what we're treating and they won't spread to other patients. In terms of triaging, you triage people with TB signs and symptoms or with a disease, and community health workers are required to promptly identify presumptive TB cases. We did that very well during COVID, where we're screening everyone and fast-tracking and making sure that people under investigation, they are separated from the rest of the team and investigated further. Screening should be integrated into other disease programs. I've just mentioned, I've given an example of COVID. So in terms of separating safely, it will also depend on the infrastructure. The important thing is that you separate your patients and try to put them in a well-ventilated area. An example that is given here, it is an area outside. It might not be possible to do that. It might not be covered, but we need to ensure that there is enough ventilation. Important thing is also to address patient flows and minimize mixing your patients. In terms of healthcare worker training, that is also important so that healthcare workers also have confidence in implementing the plan that we've just designed, and also know what is expected and monitor and continue to review the plan. So we also propose that TPT and also ARVs be provided to those that qualify. Some healthcare workers might choose not to disclose, but the occupational health and safety program that I mentioned earlier on will support with regards to that. You conduct regular surveillance program of the disease that also includes other conditions, and then you would refer to the occupational health and safety. And we need to make sure that the responsibilities and roles are clear. The occupational health and safety officer knows exactly what to do as she continues to conduct surveillance of other conditions, and then TB is also included and not left out. In terms of Initiation of effective treatment, it must be appropriate, it must be based on DST, and it needs to be timely. You need access to rapid diagnosis and sustainable access to anti-TB medication. There are processes on how we ensure that you don't wait until the end. And for instance, with TBT, you have to, ensure that your stock management processes are in place to monitor use and also ensure that you have enough stock. You provide psychosocial support to ensure treatment adherence. You work with organizations that will support in terms of nutrition. You involve social workers wherever possible, or work or train people who are going to provide counseling and also provide health education to family members. In terms of infection control at community level, we also recommend household risk assessment to support patients through screening, contact tracing, referring symptomatic people to clinics for testing, and in some instances where it is allowed, you would collect sputum and ensure that the disposal and transportation to the facilities follows the local guidelines. You also provide counseling to ensure that patients will adhere to treatment and also will be willing to go to the nearest facility for further testing. In terms of capacity building of healthcare workers, it is important that every time there are new guidelines that come up, we continue to provide in-service training to ensure successful implementation. And then also hands-on experience is quite helpful. Kerry mentioned that we are going to have practical sessions, so that is very important in terms of bringing confidence to healthcare workers, knowing that I have practical experience and it's likely to also improve attitude. So this is just an example of the pictures that I have here of virtual trainings that have been conducted. And if you don't follow up with healthcare workers to see, whatever that they have learned, they are really competent in doing, it becomes a challenge. It is important that we monitor the interventions that we implement. You review medical records of samples of TB patients in order to avoid exposure again. You will check time intervals. These are related to process indicators, be it when you are seen, even though not necessarily admitted. The time when you are seen and the time when perhaps sputum is collected and up to diagnosis and initiated on treatment. If delays are found, you discuss and come up with a plan to address those. I've mentioned the importance of monitoring implementation. These are just a few examples, and you'll see that I haven't included impact indicators. These are just process indicators. As an example, other countries are using this. You would look at the proportion, at country level, look at the proportion of facilities that have a written IPC plan, updated IPC plan, and the percentage of healthcare workers, for instance, that have been trained on infection control, and those that are conducting surveillance among healthcare workers. Another way of looking at it that also encourages healthcare workers is data visualization. I know that they prefer to see colors. They respond better when it's visual. This is an example to say it is important that we monitor and we give feedback if there are any gaps to encourage improvement. On the left, we have a a situation which was around 2017, some of the facilities there that had conducted risk assessment. And at the time, you will see that I've highlighted a few where they were not doing well. Screening was not done, when entering the facility, and also the healthcare surveillance program was not in place, and also no maintenance of GUV. And then later on, around 2019, this was before COVID, there was some improvement. However, that improvement takes time. It's not sudden. It might take longer than expected, or they might regress. So you will see that at some stage, with regards to training, even though in the beginning they had conducted during that period, but later on they were not conducting. But in other areas, screening improved. They also started maintaining UV lights. This is also another example in one of the districts in South Africa. We're just looking at the number of facilities that had infection control plans and those that had infection control guidelines. You will see that 2018, they were around 64%, and that improved to 88%, which was quite impressive. Same applies as with guidelines. We might think that those are easily accessible online, and that's not the case. People still prefer to get handouts, or they're not even aware about new guidelines that have been published. In summary, administrative controls reduce exposure and therefore reduce transmission, so should not be implemented individually in a way that dissociates it from your environmental controls and your respiratory protection. Where there are gaps, we need to come up with measures to correct that. And then that is my last slide. Thanks, Karen.